Shalom לכולם. Thank you very much, Kathy, for the warm words. So I'm Sinai Oren, a psychiatrist and psychotherapist, and thanks to the Jerusalem Fund, and together with my colleague Pini Boimel, we co-founded and directed the Sha'arei Nefesh Clinic in Jerusalem. And our dear friend Kathy has supported this project from the very beginning, and we are deeply grateful to her and to the entire community for this evening and your ongoing support. So, as Kathy says, we plan to be with you this day, but due to the current stage of the war in Israel, we were unable to travel and join as planned. Those dramatic and complicated times, but we all hope that the peace and the better future will grow from this painful reality for Israel and for the entire region. Those days, the support and solidarity we feel from Canada and North America communities, both in spirit and in action, are essential and deeply meaningful for us. While we are encouraged by the hope that the recent will bring end to the war and the return of the hostages, the horrific attack.
Okay. Yeah, thank you.
Okay. Yeah, October 7 and the ongoing war have caused deep and widespread suffering, both physically and mentally. As a result, an overwhelming number of civilians and soldiers are suffering with psychological wounds, such as post-traumatic stress disorder and related conditions. And as psychiatrists, we are very often facing powerless in face of a complicated mental situation. One of them is trauma. However, in recent years, there was been growing research and renewed interest in a promising new approach, substance-assisted psychotherapy. This approach offers a potential solution to a critical need, providing care that is both profound and effective, while also bring shorter and more accessible than traditional psychotherapy, which can take many years, especially in cases of complex trauma and other challenging mental condition. Treating people who have been deeply traumatized in incredible challenge. Psychiatric medicines usually don't help, while psychotherapy do help, and Israel under this circumstance become the center of knowledge and treating PTSD, but is usually takes a long time and require facing painful memories that people have worked hard to avoid. Many trauma survivors hesitate for years to seek help. Despite this tremendous suffering, they and their loved ones experience, they keep suffering flashback, nightmare, insomnia, avoidance, and related issues such as addiction, violence, and suicidality that are sadly common. So even before the war, many people in Israel were already struggling trauma, and public mental health system clinics that have long waiting lists, often more than a year, to begin treatment. And even those who manage to start therapy usually struggle to continue and to complete it because of the challenge that this process brings. The public system is unable to offer a practical solution even before, and especially under this circumstance of so many people suffering. So under these circumstances, about a year and a half ago, the president of the Jerusalem Foundation, Shai Doron, Zichrono Livracha, approached me and asked me to establish a resilience center, a clinic that will offer care to many people in need and lead a development of a new treatment paradigm for substance-assisted psychotherapy, especially using ketamine. Ketamine is a well-known and long-established medication primarily used as an anesthetic. In the past 2 decades, growing research has shown that it can be both safe and effective for treating varieties of mental health conditions. For depression, it's even get to Sal HaBriut. But because it is familiar and approved medication, we can offer this treatment in a secure, structured, and relatively simple way in the public health system. However, since ketamine is old, a drug, pharmaceutical companies have little financial interest to promote its use, what makes it challenging to integrate it into public healthcare without a system, without external support. Even though the treatment shows strong results and we see in our clinic really exciting results that people, it's changed their life. We are here today to share our story and thank you for your support so far. We also ask for your continued support for this important project, not only for not only for the people we already treating and for the family and for the people we as a clinic can treat, but also for the broader change that Sha'arei Nefesh Clinic is already promoting in other places, other clinics, other setting, and in Israel public mental health system as a whole. And for the hope that this new paradigm, substance-assisted psychotherapy, ketamine-assisted psychotherapy, offers to so many people who are still waiting for healing. So really, thank you very much, you all, and hope to keep in touch and do good for this.
And Kim is going to start by Sinai really means it, because if you're ever in Jerusalem, Donna went to the center and they gave her the first, and Max, and they gave her the first, and Max, the first class tour. And it was until then, they were like helping, but they came home and like, we're going to give it 100% because this is amazing. So you have to meet these two miracle workers and the clinic. See the clinic of team. They're an amazing team, and you'll know this is the place that's going to make a difference.
Okay, and so Penny is going to make a short presentation, and then we'll open it up for questions.
Everyone, thank you so much for not only coming and joining this amazing event, but having the patience to listen to us from the other side of the world through this quite uncomfortable medium. But it's as we spoke with Kathy, it's better than nothing, and every bit that we can get to do here is amazing. It's just heartwarming to see you all the way over there. And I'll just give a short 7 to 10 minute presentation on our clinic and what we're doing right now. And then we'll open it up for questions and answers to be, to give you the more in-depth information that you might be wanting to hear. So just very briefly, as was said before, Sha'arei Nefesh is a joint collaboration by the Jerusalem Foundation and the Sha'arei Tzedek Medical Center, one of Israel's leading hospitals, and also located in Jerusalem. Okay. So as Nomi was mentioning before, in response to the October 7th attack and the war since then, the foundation and the hospital through Sinai, who also brought me into the team, set up Israel's first public clinic for ketamine-assisted psychotherapy. through the initial donation and the support of the Jerusalem Foundation and the hospital. We had a training that we'll speak about more at length in a minute, and we trained 50 professionals, including doctors, nurses, psychotherapists, social workers, psychologists, and hired some of them, conducted a pilot phase in the hospital, in Shaare Zedek Hospital, actually in the new oncology building, for a couple of months. And then after the end of renovations, we finally moved into our current location, which we'll show you some pictures of in a minute. And obviously, you're all welcome to visit when the skies open and you're able to come in person. We'd love to give you the tour. Our program is currently providing psychotherapy for PTSD and depression, and we'll talk about other conditions that we're hoping to expand onto. I just wanted to repeat, as Sinai said, that we're using advanced methods of care, and we're keeping the standard as high as possible, whether in safety, whether in being data-backed and connected to the research. So we'll talk about that in a second. As you can see from this infographic, treatment is the center of our activities. And within that treatment, we have mostly ketamine-assisted psychotherapy with the therapy in the center of that. But around that core, we have research going on in our clinic. We're doing trainings and education and supervision for professionals in this field. And we're collaborating with leading players in the field of psychedelic medicine, of ketamine-assisted psychotherapy, of trauma work from Israel and from around the world, including Mount Sinai Hospital in New York with Dr. Rachel Yehuda leading the trauma work there, one of the most world-renowned trauma labs, as well as partners in other places. Our treatment protocol is roughly spread out on this graph before you. I won't get into the details too much, but we have a very personally tailored treatment protocol, which is collaborative and flexible. The therapy, the psychotherapy, the talk therapy, or the trauma work in our case is the core of what we do. And we apply ketamine as a therapist's assistant or as an aid to make the therapy go that much farther and that much better. We do that because we appreciate the potential of the medicine's action, and we know that research shows that it's effective. But since we're treating trauma and we're treating ongoing trauma while there is still war, and because everything we're doing is on the verge of the new understandings of psychiatry and psychology, we're doing everything we can to make sure that our protocols are not only as effective as possible, but also as safe as possible, and rooted in what is already known in science and in psychology. So we're using evidence-based practices and culturally competent practices. We have so far in our clinic also treated ultra-Orthodox Jewish clients. We have clients who's Arab clients. We have a therapist who's an Arab speaker. And we try and make the treatment, because we understand the depth of the connection between the therapist and the client as crucial, we try to make it as tailored and as fitting as possible. Our patients come in for a 2 to 3 month treatment course that, again, is the length of it is decided according to their needs. And in that course of treatment, we have a preparation phase. Then we have ketamine-assisted psychotherapy going once or twice a week for a couple of weeks. And then we have a phase of closing that course of treatment and figuring out what are the next steps, as well as a follow-up to see what can we learn from this treatment and how can we better the other treatments that we do. Our multidisciplinary team, which I think is one of our most amazing assets, is led by Dr. Sinai. He's our psychiatrist and medical director. Together with him, we have Sarit, who's our administrative manager, and myself, and a team of amazing nurses and therapists who are, in the end, they're the ones that are meeting our clients day in and day out and doing the amazing work with them. And we had the amazing pleasure of being able to choose some of the best therapists that we can find, due to how groundbreaking this type of work is. And our therapists are also MDMA trauma trained through MAPS, and also ketamine-assisted psychotherapy trained through the training that we did. But before that, they are trauma specialists and therapists of the highest degree. And we see that as something that's crucial for the type of work that we're doing. Very briefly on our clinic. So the entire clinic was designed and renovated, and the building that we're housed in right now is actually the building adjacent to the Jerusalem Foundation. So we're right next to our biggest benefactor and supporter. It's actually quite convenient. We renovated the clinic from the initial donation that was spoken about before. And we had in mind the special needs of clients and of therapists in this type of work, meaning with deep emotional and sometimes spiritual or mystical experiences, sometimes with music or with some other noise that might be. So we tried and designed the clinic as best as we could for that. We have 5 therapy rooms. We have a psychiatrist's office and a nurse's room. We also specially designed a integration lounge, which is basically the room where the patients can go and recuperate after the session. And this way we can also clear out the therapy rooms for the next clients, but still maintain the top quality of care that we want and have them under some kind of supervision, but also continuously doing some of the therapeutic work on their own after the session. And the facility that we renovated is fully accessible for potential clients, maybe in wheelchairs or with other special needs. And all in all, a healing, comfortable, professional environment. So here's some pictures. Ignore the pink one, I'll get to that in a second, but you can see some of the therapy rooms on top, and then on the middle you can see our integration lounge with those comfortable sofa recliners. The group room, which is where we do group therapy and others, and you can see Kathy during her visit with us in, I think, the last visit. The pink picture on the other far side is from the ketamine-assisted psychotherapy session that happened this week. That's the bomb shelter underneath our clinic, and we actually had to set it up in order to have one of the sessions that we decided that we want to give this client the continued care that they need, and we kind of set up an ad hoc session in the bomb shelter. We're going to be doing that again this week. Hopefully that'll be the end of this type of room that we'll be using, because it's much more comfortable in our clinic, and hopefully we won't need the bomb shelters anymore very quickly. But it was just a very beautiful, inspiring session. I had to say, listening to the music coming out of the bomb shelter and this pink kind of light, it was very heartwarming and also terrifying at the same time. I think that's part of the situation that we're talking about here.
Hi, my name is JJ Lewis.
I'm going to let you listen to a 2-minute testimonial of one of our clients. JJ Lewis, he finished our treatment, I think, just about 2.5 or 3 months ago already. He was one of our pilot phase participants. He came into our clinic with quite difficult PTSD symptoms and a reluctance to see another therapist who will just talk to him. And he wanted to share this bit with you, so I'm gonna share this. 1 second. Hold on, sorry. Here we go. 1 second.
Hi, my name is JJ Lewis.
If you can hear it, raise your hand.
On October 7th, I was pulled out of a family bar mitzvah and went directly to the south. The first 2 weeks or so, I was involved in a lot of operational activities within Israel. And then I proceeded to basically clearing the affected towns. The affected towns around the Gaza envelope, which basically meant making sure that they were safe and cleared out enough for non-army people in order to visit those areas. I saw some very, 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 very rough and raw things while doing that. This affected me because only a month before the start of the war, I lost my job, and due to the events of the war and the various areas that I was in, I found it very, very difficult to restart. Thanks to the Shari Nefesh treatment and also their therapeutics that were involved, I was eventually able to find another job, restart things after about a year and a half of being out of work. And essentially what happened was I was stuck with this like tightness in my chest and this inability to move on and progress throughout the time, and the help of the therapeutics in combination with therapy allowed me to move on and sort of release the weight from the world. And I will say that the therapy on its own didn't really do that much. It was mostly the effect of the therapeutics that were involved in the treatment that allowed anything to happen and help out. It being in a medical scenario, but at the same time being distant from a hospital, made it more open for somebody to treat. Combat soldiers tend to find it fairly difficult to reach out and ask for help, and because Shari Nefesh is built the way that it is, it made it possible for someone like me to get the help and be able to move on and continue onward with life.
So this is one example. We have so far treated close to 30 patients now. When we did this chart, it was still 20. We had festival survivors from Nova Festival. We have some volunteers from first responding agencies such as Zaka. And I think it's Sinai said this before, and I think Nomi also mentioned this. It's hard to say who won't be a potential patient for this type of work right now in Israel. The type of work that we're doing, as you can see from the examples, I won't read this out to you, but just 3 examples out of 20 or 30 patients that we had. The significant mental health improvement that we see is not just in PTSD symptoms. It can also be in marriage issues. It can be resolving issues and returning to work. It can be anxiety and depression decrease. And we look at this, I mean, as a social worker, I see this not only as diagnoses which we are treating. We're treating people, and we're treating families and systems around those people and families and communities. And we see major shifts in these people's lives. And it's just been very, very heartwarming to see the kind of betterment that people find after being treated with this kind of treatment. Second. Okay. And our training that I talked about, I'll just show you this short film as well. Thank you for your patience. Raise your hands if you can hear again.
באמת חייב להביע הערכה גדולה. יש לכם תפקיד מאוד חשוב.
צורך הוא כאן ועכשיו. דוקטור סיני אורן בא אליי עם המספר הבלתי יאמן של 500,000 ישראלים שיסבלו בתופעות של פוסט-טראומה כאן ועכשיו.
אני חושב שזה קשה להפריד בחשיבות ובמשמעות של העובדה שההכשרה כזאת קורית כאן במסגרת הרפואה הציבורית בישראל.
איזשהו משחק כזה בין בחוץ, אני כאילו מאוד מרגיש כזה את ההתבוססות בתוך הכל, גם כזה נהיה נורא רגיש מהכל, בעצם גם המטפל עובר את אותו, כאילו, את אותו השפעה של ה-EMDR שהמטופל עובר.
נסעתי בעצמי בעצם, מאוד מאוד עזר להיות מטפל, בעיקר בהרגשה שלא צריך, מה שלא צריך, כאילו להרגיש בנוח, פשוט לשבת ולהיות נוכח איתו.
I don't see myself as a fixer. I don't know if any of you do, but I think our jobs are different and complex. The most important thing of all is to be able to sit with people in their pain, and if possible, help them a little bit along the way.
So I just wanted to add 2 more words right before we talk about the research, just about our training. So we managed to not only create this training, which was the first big public one here in Israel for ketamine-assisted psychotherapy, but also to have an experiential component to it. And following some of the research and understanding of this type of work, we felt that that was an important component to offer to some of the therapists or whoever the therapist that wanted to experience that in our training. And we managed to come to an understanding with the hospital and the health system about how to do this in a professional way. And that was the training that you just saw. That was last April. And we're looking forward to create more of these trainings. I'll just say that many of the therapists that participated in our training have been working with either Nova survivors or other types of, immense trauma patients over the first year of the war from October 7th until our training. And many of them testified that even just the experience that they went through in our training with us, with the medicine, with the holding, with the learning that was done, was highly beneficial for them. So that's something also to remember, that when we're talking about therapists, we're talking about Israeli therapists right now who are also carrying quite a lot of weight, especially since October 7th, but also ongoing. So that's about our training and about our team. The research that we're doing in our clinic is also very important. As you can see, there's been a surge of research in psychedelic-assisted therapy, substance-assisted therapy, ketamine-assisted therapy, and especially for PTSD, which is usually understood as quite a difficult diagnosis to treat, especially with talk therapy or the older types of psychiatry. And our research is not only continuing that surge, but also expanding it into new realms. And we hope to be doing that also in our clinic. The program is led through the hospital by Dr. Sinai and Dr. Aaron Cherniak, who's our research coordinator. We've working on our protocol development from the beginning, and we have already submitted ethic committee for research, and we're moving forward with the research on the ketamine-assisted psychotherapy that we're doing in the clinic, as well as using strategic consultations and collaborations, as I mentioned before. But we also are looking to expand our care in the clinic and the tools that we are able to offer our therapists and through them to our clients, to additional psychedelic treatments, which are now only done under research, whether MDMA, psilocybin, or other substances, obviously all in the similar context of psychotherapy in the center and a very therapeutic-based perspective on how to utilize these substances and the experiences that they allow in a very safe, secure, held, scientifically based therapy process. And just one last slide. Thank you again for being with me through this. Looking forward, from the past year and a half, I think we know one main lesson, one takeaway that we have from the past year and a half is that sometimes things happen and then growth is much faster than we imagined. And sometimes the need is much bigger than we even anticipated. So looking forward, obviously we can't know the future, but we can definitely say that for mental health in Israel, the future is not amazing in the way that many people will need help, but also we hope to step up to that task and expand and scale out and educate others and continue the way we've been impacting the field. We've already impacted other hospitals that are joining this type of efforts and opening their own clinics. The work that we're doing right now is mainly not only there's a dual purpose here. We're helping patients, obviously, and we're helping them and better their lives and get over some of the difficulties that they're suffering from. But we're also continuously and effortlessly and tirelessly pushing this type of work into public health in Israel, maybe in ways that are somewhat similar to Canada. The public health system in Israel is the main health system. It's the major health system. It's the system where most people get their care, and it's definitely the one where accessible treatment is offered. And that's why the mission that Sinai recruited me to, and that he's holding up that flag, and I follow him with that, is getting this into an accessible, subsidized public health system and up to standard with the private world, which is developing around us as we speak, even here in Israel. So our next steps include getting back some of our revenue from coverage from the HMOs, from the Kupot Cholim here in Israel, and from doing various other activities such as therapy groups, trainings, and internships that can help us create a more balanced budget and a sustainable model for our clinic. In the short term, over the next year, we're going to double the amount of therapists that are working with us and treating that much more patients through that. Groups and retreats and other pilot phases for different modalities are also going to be launched this year. Trainings and fundraising activities. And obviously, like we said, to advance the research and expand all of our operations. For that, not only do we need your help, we're also very thankful for the initial help that we got from the Jerusalem Foundation and the American donor that allowed the runway, the beginning of this. But we definitely, even for the next 12 months for our short-term goals, we will definitely need as much support as possible. In the longer term vision that we have, we're looking to get national recognition of this type of work through inclusion in the health basket, which means that people will get this treatment subsidized, not through philanthropic subsidiaries as we're right now offering it, but through the Ministry of Health's agreement with the different HMOs. We would also like to conduct large-scale trials, whether with ketamine-assisted psychotherapy, but also with other modalities, with technology and with other substance-assisted therapy modalities. And we're going to expand not only the trials and the research, but also the services. And for that, we also need to expand our funding, obviously. And I think that's where it's appropriate for me to stop here. And first of all, thank Kathy from the bottom of my heart, because she knows that this type of work is not only very, very meaningful, it's not only important for the people of Israel and the people who are suffering in the Middle East and maybe around the world, but for me, this has been a personal dream for about 10 years now to get a clinic running that does this type of work in an accessible way. And for that, my personal gratitude, as well as I know the gratitude of our entire team and Sinai as well. We are so thrilled and happy to continue to do this work through terrible times, unfortunately. But we are, I think, I can testify just from the past week and the conversations that we have inside the clinic with our therapists and with our nurses. Everyone is willing to come into work. It doesn't matter if there are bombs going off. It doesn't matter if rockets are falling. They want to be there. They want to help. They want to be there for the clients. And I think that's something that you're allowing through your generous donations and your support and your love, and hopefully your visits and your friends. And I just want to say that this is for me, it's not enough because I'm not in the room with you sitting there feeling the love, but this is for now the best we can do. So thank you for your patience.